Fine.
Good. And hello, Ronalds. How are you doing?
I'm okay. I'm okay. Thank you, Chris.
Good. And President Moses, you're in your last month or so of your term. How are you doing?
I'm okay.
Yeah.
Otherwise, how is US?
Yes.
Okay.
I sent you the copy of a big proposal yesterday or Saturday, I guess. Have you seen it?
Yeah, I saw it, but I've not got time to go through it in details. Though I've seen it. Yeah.
Yeah. Good. Good.
Yeah.
Well, take a look at it when you can.
Yeah, I'll take a look at it. Yeah.
It's Rotary stuff, and I don't hold my breath with their giving positive answers or giving any answer, but so what?
Actually, I've had some things to do, some of my publications, so that's why I've quite been busy. But
Yeah.
things are getting on. Yeah. Otherwise, I'll look at it. I opened the mail briefly. I did go into it in details today. Yeah.
Great.
Yeah.
Last time we saw Gloria, she had her grandson on her lap. Who knows whether we'll see her today or not.
I've not spoken. I spoke to her yesterday, but today I've not spoken to her. I just sent for her email. Maybe, today is NED. If she doesn't appear, there might have been some other issues which should have got her up. Yeah.
Yeah. I don't see anyone else. Should we go ahead and start the meeting? I assume other people will join us sometime, but waiting for people to come late doesn't seem fair to those who come on time.
Yeah.
So the first question is, what would you like to see on the agenda? Any suggestions?
Yes, Chris. Now that our timeline is getting closer,
Yep.
I wanted us to look at the evaluation of how far we've moved in the respective areas that we assigned to ourselves, and also try to set another pace, because I see the time that we speculated is almost like tomorrow.
Yep.
Thank
Yeah.
you, Chris.
Anything else? I'd like us to discuss a couple of additional things. And one of them is whether we should which interventions we can say are highly, highly effective, and that we've got data showing that they produce the results. And the next one is some discussion of whether we should go for more villages or more interventions and fewer villages. So I'd appreciate your ideas and thoughts about that. Is that acceptable?
Yeah, I think so. You know, it's evidence-based. So if we put in interventions which have not been effective, definitely, you know, those people at the review stage will look at it and they will throw it away since we don't have evidence in it to affect our proposal. That's what I think.
Yeah, I think you're right on that. So should we discuss Ronald's point about what have we done so far?
Yeah.
So in WASH, I've got basically a baseline survey that can be downloaded to, it's a GIS survey that can be downloaded to cell phones and used in the field. And then the data from it automatically uploads to this site called MWASH. And then it exports into Excel spreadsheets. And that's all automatic other than clicking export. And it's very, very easy to analyze the results. So that's one thing in WASH. And then for my Rotary Club, which is supposedly the top Rotary Club in WASH. I hope that's not true, because if they are, we're in trouble. But anyway, for my Rotary Club, they gave me facilitation of a scoring system, developing a scoring system for WASH projects. And so I've developed a scoring system, and it it is for community WASH projects, one scoring system for schools, a slightly different scoring system, and for health centers, a slightly different scoring system. And the reason for those changes is that all of them are have different situations. A health center WASH project can't logically be thought to eliminate diarrheal diseases, because diarrhea is basically a community phenomenon, and just doing it in a health center, I can't see any way that it'd eliminate diarrhea. So we've got a new person online, one of the assistant district governors, and whom I met in Uganda back in 2019. in doing wash in Fiji district, Kyambadde Richard. Hi, Richard, how are you?
I am good, thank you.
So Richard, we're planning programs of scale, and what we put on our agenda is, first of all, to update what we've done with our different assignments. And the second thing is what interventions that we've got data showing that the intervention is highly effective, because the program of scale is based on highly effective interventions. And I talked with the first program of scale people in Zambia, and they went in only with malaria and only with diagnosis and treatment at the community. Well, I guess at the community and health center level. And they didn't have anything else in their program. So we may want to, the first thing is what we've done. The second is which interventions we've got data showing that they're highly effective. So ready to go to scale. And then the third question for our agenda is whether we should do more villages or more interventions. Do you have anything you want to add to that agenda, Richard?
No, I'll just follow in.
Okay. Well, good. Any further questions about WASH? You've got, well, I've also got a suggested guideline for a community process for WASH, and I think I've sent it to everyone. If I haven't, let me know and I'll send it. Any questions about the WASH component?
I think you have given a detailed about us. We have that backup. Maybe in future, if as it progresses, if our report also is out, we can also put, but ours more of it was also a global grant, a school level intervention, which has been very, very effective, increasing uptake, also in improving community within the school. So it's great. There in WASH, we have data which we can actually use to show really that it can be scaled up. That's my feeling about it, how the communities were involved, which level, how did we enter into a community system, how do we intend to sustain it, how do we feel the community can really own it. So I think in that sector, we have data which we can actually use. That's my compliment to that area of intervention, yeah. In WASH.
Your school global grant, very good.
Yeah.
With data, good. Anything else? Ronalds, would you like to report on your assignment area?
I beg your pardon, Chris.
Did you want to do a progress report?
Yes, I just wanted to, because you remember Masindi, when we were expressing areas of interest, WASH was one of them. And currently, we are already in touch with the district water officer, and the district water officer has told us the key issues that are affecting, and we have a challenge in our hospital, that is Masindi Hospital, where we intend to do a maternal and child health project. And one of the main challenges is that they have already the water system, which is there, but it was constructed in 1920. And
Wow.
and currently the water bill that it occupies in terms of pumping water is it takes almost 75% of the electricity which they use in the entire hospital. So as a result, it has exposed the hospital into issues where it cannot afford to pay water. And they also gave us some data relating to how much they have been writing to the water office trying to plead so that they can leave the water on. But even when they leave water supply on, does not stop the bill from counting. So our intention is to, recently we took the architect, the engineers, to do a baseline, and they also did that baseline. They were doing the baseline regarding the entire project, that is the maternal and child health. And currently we are getting a report in 2 weeks' time. We are doing this with in collaboration with the Rotary Club of Boyogere Nambole. So at the moment, I just wanted to let you know that that's where we are. But as much as we can, Chris, I will be so glad if I can get an attachment from this team, especially someone who has been well versed with the water and sanitation wash projects, because we feel we don't have a lot of expertise to benefit from as far as RC Masindi is concerned. So far, that's what we have done. Thank you.
Good. Good. And if I may, let me suggest that one expert you might reach out to is Kyambadde Richard, who is a Rotarian, and I forget which community he's in. Which community are you in, Kyambadde?
Hello?
Yes. What is the town you're in? I don't remember.
Mitiana.
Okay, so Ronalds, have you reached out to Rotarian Kyambadde? He is highly experienced in water, sanitation, hygiene, and can give you lots of help in that area. But I'm happy to help also. Anything else on WASH before we move to what? Helene, what we're doing is presenting on the progress in our different areas, and we've reported on the progress with WASH. Do you want to report on microloans and what we know about the effectiveness of microloans and the methodology you have, so that people can know and understand that? And if there's any way to do it relatively briefly, that would be best.
Okay, duly noted. Okay, so the obvious goal of microloans is to get money into the hands of the entrepreneurial poor so that they can improve their businesses which they do, and then they wisely use those increased earnings to keep their kids in school, to provide better nutrition, and do all the things that all kinds of NGOs are trying to accomplish. But if we get money into those hands, you know, the women know how to do it. The other goal of our program is to provide funds for good organizations to do community projects. So we've asked Innocent to give us an accounting of how TCP Global earnings have recently been used in Yumbe, because my hope is that we can get a sizable amount of return from the TCP Global program. The partner that runs the program gets the interest. They also are entitled to 50% of the money that we send after it's invested twice. And that's money that you can invest in WASH programs, in education programs, in trying to increase food production to ward off food insecurity. So an equally important part of the TCP Global mission is to provide money for good organizations to try to meet their community's needs in many other ways. So Innocent and CEDUC, since they have so many programs they're running, will be a great opportunity to demonstrate the potential of how earnings can be used. Because I know you're going to get hopefully you'll get this grant from Rotary, but there's also the ongoing needs that have to be met, and a strong TCP Global program in each of these areas will provide funds for that ongoing need.
Great. Do you want to explain the links to BSLA to TCP Global microloans to process and reporting, and maybe the coverage in Uganda, how many participants, and also the relationship to the women's, I forget what it's called, the members of parliaments, women's affairs, women's empowerments, Uganda program that already exists, but maybe is not as effective and might use TCP Global as a model.
Okay, and you still want me to be brief, huh?
Yeah.
Okay, I'll do my best, and feel free to cut me off, but there were a lot of questions there. Okay, so TCP Global originally worked with grassroots organizations that had a bank account and were registered, and they would just provide loans to their clients. When we started partnering with CEDUC, Innocent brought to our attention that there were all of these VSLAs, these Women's Village Savings and Loan Associations, that had a year or more experience managing loan programs from their combined savings, and they wanted to manage larger amounts so that they could give larger and more frequent loans. But they didn't have bank accounts, they didn't have computers, they didn't have the ability to interact with an international organization. So Innocent and CEDUC agreed to be the fiscal sponsor for all these women's groups. And I think now he's managing about 34 groups. And we have close to 50 groups throughout Uganda in total, but Innocent is managing about 34. So they run their programs. We send the money to CEDUC. They give 100% of what we send them to those groups to distribute. And then CEDUC gathers the information and sends us the reports, because we determine when a site can have more money by looking at the reports of how often those initial funds have been invested. And we have a similar setup with Fitch in Oyam and near the Lira Rotary Club. And we have a program similar in Nepal. So this is a model that we've replicated in other areas, because it enables us to reach the poorest people, and also the people with the lowest risk for us, because so far these women's groups have a 100% repayment rate, because they're already committed to expanding each other's businesses. Chris, you had some other questions, which I've totally forgotten.
Yeah, so that in Uganda, you've got more or less 1,600 participants, right? And the 50 groups, more or less. And are there any questions about the microloan program, which fits into Rotary's community economic development focus area?
Yes, Chris. Mine is about how best we, as the Rotary Club of Masindi, what opportunity we have to learn more about the model and see how we can use the information to possibly support our communities. Because in Uganda, whatever problem or challenge, community challenge affecting Northern Uganda, its resting point is in Masindi. Because as you are aware that all people who are completely inconvenienced, they have to move in terms of refugees, and they settle in the Greater Masindi. The Greater Masindi is made up of Kiriandongo, which houses one of the biggest refugee camps, and these trickle down to Masindi and the Vulisa areas. So if you look at the poverty index in the target group, Helen was telling us in brief. I don't want to preempt what the baseline would be, but from experience, I see that we need to interest ourselves more into this project. Thank you. So I would like an opportunity where we can further this in terms of Masindi getting to learn more about the project. Thank you, Chris.
Yeah, I look forward to those talks too. Hopefully, if you can find out how many VSLAs there are in your area, and we could figure out a way where you could do something similar to what CEDUC is doing to give those groups access to more loan funds.
So in the invitation list, Helene's email is listed as helenedudley@yahoo.com. And if you write her and send her information about the VSLAs in your area, then she can give you further information. Basically, what TCP Global does is once a VSLA is highly successful, TCP Global gives them some additional capital to loan out. And the model, according to what we're hearing back from women all over the world, but especially in Uganda, the model results in wiping out hunger in the family, wiping out school dropout, wiping out so many. I mean, it's just astonishing what happens. And the data is automatically reported from the field, and well, it's not automatically. We have a system to upload and be able to report to Rotary or whomever how many loans went out, how many were repaid, at what interest rate they were repaid, and it shows effectiveness according to those indicators, extremely high effectiveness. Anything else on the microloans?
Maybe just in the application, we will have to also spell out exactly how the microloan will lead into as helping sustainability of the program. So the link between microloan and maybe WASH. So you look into that to see how the use of microloan program has impact on the other programs which you implement, if you will have to include in the program of scale. Remember, during the previous review, they were saying that's what they were actually looking at.
Excellent point. And
Yeah.
we're starting or considering with Innocent and Yumbe an additional interaction between microloans and WASH, which is once the communities get especially if they get a borehole or rainwater collection system, we're suggesting that they pay a fee, a monthly fee for the water services. So it's a relatively low amount of fee, but one of the things that we're considering is frequently with WASH programs, the system does not fail the first year, the second year, the third year. And so the money from the water fees just sits idle. And our question is, why not put that money in a microloan program and let the community pay, say, community participants pay, say, 20% a year interest on their money as they make more money with their WASH money, and they're only being a condition in they're using the money that they will definitely use the interest and maybe even the capital when necessary to repair the water system. So the TCP Global can conceivably help the water system from externally funded, but the water fees could result in a WASH program, a microloan income generating, interest generating program. What do you think about that?
It's okay. It's a way of saving, because if the Oxwell it acts in two ways. One is protecting the fund, because if the money is sitting in the hands of, there are two alternatives. If the money collected is deposited in the bank or is put into the microloan, because some communities tend to lose out because when they collect the money, they keep the funds in their houses. At the end, the leaders end up eating up the money, which end up affecting the WASH program. So if since access to financial institutions are very hard in those rural community, then it might be good to put it in such a microloan organization. Then it is used when the time has reached, because when such facilities are already new, it takes some time for it to require some repair or some replacements.
Excellent point. Thank you, Moses.
Yeah.
So should
the interest earnings are really much larger than most people realize. So whatever amount of money that you would have put aside for the WASH programs, based on the interest rate that's being charged in Uganda, you could get 1 to 2% per month in earnings from that invested money, so that your money will actually grow. And by the time you need it, you might just be able to live off the earnings instead of the principal. And plus you'd be helping a lot more people in the community. So if anybody wants, I can send you, so in Uganda, our partners have earned a total of about $70,000 since May of 2020 for running the microloan program. So that's $70,000 is a lot of money.
Any other questions or thoughts before we move on to what I'd suggest, malaria?
Yes, please. I need to chip in a bit about the microloans here in Yumbe. As Moses has really said about microloan linking to WASH program, even in agriculture, that is exactly what has happened with the women groups here. Especially, I looked at it in Bidibido refugee settlement. Now, some women, the profits they've earned, they've started using it to build latrines and then installing tip taps. And then others use the profits to farm the land. So I think microcredit loans can easily be linked to the WASH programs, to agriculture. I think that is really very great project, which is really doing here in Yumbe so far well. And the women are really doing great in microloans. I'm really very happy to that. Thank you, Helene.
Yeah, and our success is because we have such a great partner in CEDUC. So thank you, Innocent.
Thank you too.
Well, and also we have a partner in a Rotary Club in Yumbe that is largely constituted of the microloan participants.
Yeah.
Helen,
Yeah,
did
it
you
is.
say CEDO? Sorry.
Go ahead, Ronald.
Did you say CEDO, Helen, or CEDO?
CEDUC. Innocence organization.
CEDUC is a local NGO based here in Yumbe in partnership with TCP Global.
Okay, so I was a bit confusing it with the one we have in Masindi, which is abbreviated as CEDO. I've just put it on the chat.
That is different. CEDUC is care communication, abbreviated as a CEDUC.
Okay.
Yeah.
Everybody likes CEDUC, but there are many CEDUCs. Thank you.
He has an element of community, something.
Yeah. Should we move on to malaria?
Yes.
Yes.
All right. So I've got a little bit of information with malaria. We've done several malaria projects with Innocent, and he's starting up the third test of our programming in Yumbe, in a village called the Chiba. And basically what's done is liaise with or talk with the district health officer and the district malaria officer, get an agreement with the LC1s and the community, and then buy enough rapid diagnostic tests and ACTs to test everyone for malaria, everyone in the village, household by household, and treat all cases of malaria that we find. And at the suggestion of the Yumbe malaria officer, this time we're treating everybody else in the household, even if someone is diagnosed with malaria, treating everybody else in the household on the presumption that they probably have been exposed, but the malaria has not manifested yet. And so if we treat, then we will really eliminate malaria from the village. So we've got that methodology. We also coordinate to get the long-lasting insecticide treated nets for everyone in the household, which of course, it seems like no one has enough long-lasting insecticide treated nets. And then we also have a household by household data collection system that's also a GIS system and also automatically uploads and also automatically when you click the button, it downloads all the data to an Excel spreadsheet that I can analyze hundreds of households, what's happening more or less, not real in-depth analysis, but I can analyze malaria rates among the entire village, malaria rates among children, LLITN coverage, good LLIT, whether the nets are in good condition or not, that coverage, I can analyze that in 5 minutes. So it's, it's a whole different level of data collection and analysis than I've ever done before. It's almost all automated. You load the survey, download to cell phones, they collect in the field, and then it uploads, and it says what village it is, it says what the geographical coordinates of the village and even the house are, who the head of house, et cetera, et cetera. And I know that, so we're also doing that with Fitch and Oyam and Innocent. And I know that Moses and the District of Uganda, the Rotary District of Uganda, has lots more malaria experience. Moses, do you want to add on about your Arua's malaria program and effectiveness?
Yeah, I've not got the book here yet with me. We have been implementing malaria program in partnership with the Malaria Partners, Rotarian Partners International, now called Malaria Partners Uganda, and the Kuluva Hospital. Also, we also included the village health team in the program, which we have done since 2018, if I'm not mistaken, where we use the village health teams to identify, treat, and also help those villages with mosquito repellent plants. Also, we have that. Mostly, just like what you have been doing, what we did was training those village health teams on to how to implement a malaria program in their communities. Since we knew that the village health teams are nearer to their community than us, we used them in a collaboration with the Kuluva Hospital. So whatever they do is they will go to their communities. They tested all the people in the community. After the testing, those ones found with malaria were treated. Then case by case, those people will report in case they don't feel well to the VSTs about cases of malaria in their community. And we had also monthly, also quarterly meetings with the VSTs where they will actually report. They'll give a report of what was happening in their villages each month to the Rotarians and also the management at the hospital. Actually, the grant book is already out. maybe Gloria will share a copy with you. Malaria Partners Uganda want to use the book as a reference point for small grants, and they will give it also to the Ministry of Health. They will also be using it at Malaria Partners International. So that's what how far we are with the malaria program. Last Sunday, the other Sunday, we had a bike ride where we had the bike ride against malaria to enjoy International Malaria Day celebrations with the district. Okay, actually the city and district officials, we are so happy about our interventions. They took the book. Even the resident city commissioner also wants to engage us more and see how Rotarians can help them in the fight against malaria. So it's a very interesting program. And I think if we integrate that with your knowledge, also the knowledge you had from that in Zambia, it will be a very good component into here. That's how far we have gone with the malaria program, with our program of malaria. So with the cases of our studies are in the book, which I don't have now here with me. Gloria may share a copy with you, yeah.
Excellent. Gloria shared her global grant report with me. So
yeah,
and I read it with great interest. Any other? Thank you, Moses. Any other comments or sharing on the malaria program?
Maybe another thing is the use of mosquito repellent plants. If it's there in the book, it will be interesting because we planted at the hospital and its impact is really great. So that's one very important thing I wanted members on the call to know. Mosquito repellent plants really help to reduce cases of these mosquitoes around facilities, which really help to reduce the cases of malaria.
Excellent. Anything else? Jennifer, would you care to report or to share what you're doing with the extracts from the mosquito repellent plants and soap and other things?
Sure. I'm doing some research on not only which plants, and I'm sure, Chris, you can send me the ones you know that grow in Yumbe, but I did download a group of plants that grow in Uganda that are natural mosquito repellents. And there are many ways to use them besides just planting them around your house. One way, the first way is you can make what's called a hydrosol, which is taking the fresh plants, boiling them in a closed container over a fire, collecting the steam. And when the steam comes out of a tube, you only let it come out of the top tube, run it through water, it turns back, it condenses again, the steam back into water, and that water carries with it the oils of the plants. And that oil and water mixture that comes off of the plants is a natural mosquito repellent that you can spray on people, on mosquito nets around your house. The second thing you can do is take an oil that's a liquid oil that's in your community. Probably you can buy it. Well, I don't know your temperatures, maybe coconut oil is liquid there. And you put dried herbs in it and let it sit for about 2 weeks. And then you strain the herbs out. And that oil is goes on your skin and carries with it the properties from the plants. There's another way that you can mix, and I'm reading about it, an article this morning of making another kind of a spray, which is about using the natural plants a little bit of rubbing alcohol and a little bit of water, and you mix them together and let them sit, and it ends up as another spray that you can use on people and in your homes. So I was going to make some how-to videos about all of these methods and send them in your direction.
Any questions or thoughts on that? So another possible, go ahead.
No, it's okay. It's okay. I'm enjoying what says. Okay. Yeah.
So you can also use the plants to make the water. When you make let the water and the plant soak, it becomes almost like a tea water, and then you take that water and the women can make soaps with it, and then it also carries those properties from the plants into the soap making. So there's a lot of different ways to use these plants. And on another note, there's a company that's around where I live, makes a handheld garden tool, and it's like a hook. And it's a handle with a hook, and it works really, really well for digging and planting in the garden. And they said that they would start out with sending you 50, they could send you 100, then they'll send you another 50 if people are interested for using them for gardening, especially these plants. And then I also have a link with a gentleman who runs a seed company, and he travels all over the world collecting seeds and seeing what grows in what areas of the world. And he's willing to donate seeds to your community as well. So we just have to figure out what the needs are and such. So those are connections I can bring as well.
Great. Let's see, Jack Stanley joined us. Jack Stanley, would you care to introduce yourself and tell us about your hopes for the program?
Thank you so much, Russell. My name is Jack Stanley, and I'm from the Rotary Club of Masindi. I am the assistant governor overseeing about 4 clubs within my neighborhood. I received the link to the meeting late, so I've just joined, and I may not be able to make any substantive contribution. I'll do more listening for now.
Excellent. Thank you, Jack Stanley. So what other programs would you like reports from? We've got, well, what I did not add in water is something that both Jennifer and Kyambadde have a lot of experience with, which is point of use household water filters and their effectiveness in reducing diarrhea incidents. Would either of you like to share your knowledge of the effectiveness of point of use water filters in eliminating diarrhea, the second major cause of under 5 mortality in Uganda?
I'd be happy to if
Go ahead.
I do know that there, as we know, if water has parasites, bacteria, certain turbidity in it, it can cause dysentery if it's not cleaned. And I know a lot of areas use boiling or chlorine and that sort of thing to clean their water. What we work with the ceramic pot filter, which is a filtration system made out of a clay pot that has microscopically tiny pores in it. And if you pour water through the ceramic pot, preferably it's been poured through a cloth first if it's really dirty brown water, to get the large particulates and dirt out of it first. Then that secondary water, if you pour it through the porous clay filter, it will remove 95 to 99% of everything that causes dysentery that is of particle size. So that means bacteria, parasites, worms. It can take care of cholera. It can take care of just your common bacteria. It makes it drinkable water. And if it doesn't bring water to people, that's the one thing that's hard, is it doesn't, it doesn't solve the accessibility problem of water. But if you can get water to each household, they can clean their own water within the household and keep dysentery and such down within the members of the household. Is that what you kind of wanted to hear, Chris?
Yeah.
Okay.
So Kyambadde has a lot of experience with the biosand filter also. And there are other filtering systems. And astoundingly, these point of use filtering systems, as opposed to wells and even rainwater collection, the point of use filtering systems have reports of decreasing diarrhea, cholera, Ebola, dysentery, typhoid, etc. incidents more than 90%. And lots of the studies say 99% decreases. I have a hard time wrapping my head around that, but if we follow science, then we gotta live with it. So that would be a quick and relatively inexpensive part of water systems. Any comments or questions?
Well, these filters also have to, the efficiency of these filters, they might go up to removing 99% of all the particulates in the water, but it really needs to be integrated. Whatever system goes in a point of use in a household has to also, the education around it has to be with a wash, within a wash context. So the storage containers need to be clean, the spigots need to be clean. So there's more to it than just the filter. It's also larger than that in terms of keeping all the containers around it clean, and any filter that you use needs to be maintained and cleaned and such like that. So there is some, you know what I'm saying, Chris, there's a larger picture around it.
Yes. And questions? We've reviewed the question of the reality that with program of scale, we have to produce data that we've done it and that it's highly effective. And we've reviewed our water microloans and malaria components. And part of the reason I did that was, Kyambadde, go ahead. You've got your hand raised.
Thank you. I simply wanted to emphasize Jennifer's point that any program or project, for example, that involves the distribution of filters and it's not incorporated in a WASH program that involves training the beneficiaries on how to maintain, clean the filters, can never be successful. The filter will give you clean water, but if it's stored poorly, then you go back to square zero. No work done. And if you have an integrated program, because water alone will never solve waterborne illnesses. You need a clean toilet, you need a clean environment, you need clean bodies, you need to wear clean clothes. All these must be taught to the very beneficiaries. And I like the approach that the starting point is schools. Because if children in schools practice good things, good habits, they'll definitely carry them back home. If children know they get to drink clean water at school, they'll argue their parents to do the same when they get back home. So it is very key that it has to be an integrated program, putting into consideration the other aspects of personal, environmental, and all related hygiene. And then the other thing is with point of source of filters, we have to ensure that the filters we are considering have minimal replacement parts, if any. Because usually if these filters break down and you have to replace certain parts that are not easily accessible or readily available on market, then they're ignored. So that has to be considered as you plan. If we need to get replaceable parts, where will they be found? What is the cost? How are the people going to be trained to fix in the parts and all that? So the other thing is culture. The culture of the end users has to be considered. What is the culture of the people? Thank you.
Excellent, thank you. Well, we're over our 1 hour period. Should we set a next meeting date? And maybe by the next meeting date, we'll actually have published guidelines from Rotary International. Is that all right with people?
Yes.
Yes. Yes.
Let's see, we can set it either for June 6th or June 13th.
June 6th is the Rotary Convention in Houston.
And Helene, Gloria, and I will all be at the Rotary Convention. Will anyone else be at the Rotary Convention? Good. Would it work to have the meeting June 13th?
Works for me.
Is there any opposition to June 13th?
No.
Let's go for it.
Works for me.
It's
All right.
okay.
Good, then should we have it at the same time? Does this time work for you in Uganda?
This time it's okay.
And Ronalds, you have your hand up?
Just wanted to let you know that we also did not talk about issues of education, and it is something that we had started on. Maybe it can be featured in our next meeting. That's all I wanted to say. Thank you.
Excellent. Let's have it for next meeting.
Yeah.
So June 13th at 4 p.m. Uganda time is next meeting, and I will send out a recording of this meeting and maybe very, very, very brief notes of what all we said in it. Anything else before we conclude the meeting?
Sounds good. Thank you.
Thank you so much. I learned a lot, and found it very stimulating. Great to see you.
Great to see you all.
Yes.
Thank you so
Okay.
much. Yeah.
Thank you,
Yeah.
Moses.
Bye,
Thank you,
everyone.
guys.
Good to see you,
Bye.
Ronald.
Stay
Kyambadde,
well.
thank you.
See you
Jackson,
all next time.
Yeah, Innocent, thank you. Jennifer, thanks. How about